In our vast age of information technology, still one of the primary ways we receive information is through hearing. Hello, welcome to Advocate on Call. I'm Stephanie Johnson. So whether you're attending a business meeting or listening to a loved one share their thoughts, excellent hearing is one way to ensure life can be music to your ears. Today we're checking in with Dr. Angelique Cohen, who's going to tell us why it's so important every man and woman get a hearing exam. Let's meet her, shall we? All right, so tell us a little bit about yourself and how long you've been practicing here in Libertyville, Illinois.
I'm an otolaryngologist. I have been practicing in Libertyville area or Lake County since 2007. I finished my training in 2001, so I've been in practice for about 11 years.
So can you tell us why it's so important that men and women kind of pay attention to their hearing?
Well, hearing is essential to everyday life and communication. We use it all of the time, not only with our loved ones, but at work and communication with others. And it's often ignored in the U.S.
Tell me some of the things that we may not even pay attention to that might impact your hearing.
Well, some everyday noise exposure risks would be perhaps listening to music excessively loud with an iPad or iPhone. If you're going to be around noise and you know that you're going to be going to a loud concert, wearing some small earplugs for noise protection would be a good idea.
Okay, so what can you expect when you're getting a hearing exam?
You'll meet with the audiologist who will maybe put some headphones on your ears and have you listen to different frequencies and tones. May test your eardrum mobility and some other essentials of inner ear hearing, but it's painless.
It's painless. In general, how often should you get a hearing exam?
Well, there's no guidelines for adults in terms of how often, but in general, if there's any question to your ability to hear well, or if there's any complaints from others around you, or if you may have some noise exposure in your life or family history, it would be important to get that checked. If it is normal, you could go on a as-needed basis to have it rechecked if there was any change in your hearing. And if it was abnormal, you would follow closely with an ear, nose, and throat physician. Well, to see an ear, nose, and throat doctor may take anywhere between 15 to 30 minutes, depending what your complaints are and what your needs are. An audiologic battery of testing may take anywhere between 30 to 40 minutes.
All right, thanks, Dr. Cohen. It's been great. The whole entire office, just wonderful to meet you.
Thank you.
All right.
We loved having you.
All right. And that wraps up this edition of Advocate on Call. Be sure to check out upcoming healthy segments right here in the newsroom. Until next time, stay happy and healthy.